Hello, let's talk it out. Cervical cancer. According to the estimates of 2018, it was observed that 96,922 cases of cervical cancer occur annually, from which 60,078 deaths took place. Seems high, right? That's because cervical cancer is the second most common cancer and it is most frequent in 15 to 44 age group. So here are all the answers to your questions. Now, let's start with the basic and most important question. What is cervix? Cervix is the connection between uterus and vagina. It has three main parts: endocervix, transformation zone, and ectocervix. The part of cervix that opens into uterus is called endocervix and is lined by columnar epithelial cells. Transformation zone is the area where both columnar and squamous cells meet. The part of the cervix that opens into vagina is called ectocervix and is lined by mature squamous epithelial cells. Based on the type of cells affected, squamous cell carcinoma, most common type of cervical cancer that arises from the squamous cells of ectocervix. It begins in the transformation zone. Adenocarcinoma is the type that arises from columnar and also called as glandular cell of endodermis. Adenosquamous carcinoma is also called as mixed carcinoma that has both squamous cell carcinoma and adenosquamous carcinoma. Cervical cancer is caused due to HPV, that is human papilloma virus. It is sexually transmitted and very common in sexually active male and female. It infects the transformation zone and it mostly resolves on its own. Over the time, if HPV infection is not resolved on its own, then it may turn normal cells into precancerous cells and then into invasive cancers. HPV type 16 and 18 causes 70% of the cervical cancer and precancerous cervical lesions. The persistent infection is caused due to E6 and E7 viral proteins. E6 viral protein causes inhibition of apoptosis and E7 causes inhibition of cell cycle arrest of infected cells. That causes dysplasia, that is, normal cells changes abnormally in the cervical area, and it is called as cervical intraepithelial neoplasia, CIN. Based on the severity of abnormality, CIN is classified as CIN1 mild changes in cells, CIN2 moderate changes in cell, CIN3 severe changes in cells. CIN resolves in its own. CIN2 and 3 are precancerous and may become cancerous. So what are the symptoms for cervical cancer? It develops very slowly and gradually creeps on you. That is why early stages don't really show any symptoms. However, advanced stages show signs and symptoms like vaginal bleeding, vaginal discharge with foul odor, pelvic pain or pelvic pain during intercourse. Risks. Now, moving ahead with the next question, that is who? Who are at the risk of getting this cancer? That is, female having multiple sexual partners, being immune compromised, having other STDs will increase the risk of HPV and in return cervical cancer. Also in the female who smoke, take birth pills for longer time, take miscarriage prevention drugs are at the high risk.
Why are screening tests required? As the phrase says, be cautious, then sorry. Screening tests are used for early detection of precancerous cells. These cells can be treated and cervical cancer can be prevented. HPV test. As HPV is the risk factor for development of cancer, it is important to be tested for high-risk types of HPV. Pap test. The cells of cervix are scraped by using a spatula or a brush and are then sent to a laboratory for observation. It is checked whether the cells are normal or abnormal. It is to be noted that screening tests are not diagnostic tests. I repeat, they are not diagnostic tests, and further tests have to be done to diagnose precancer and cervical cancer. When should the screening be done? All females of age 21 and above should get Pap test done after every 3 years. HPV test is only for females who are above 30 years old. Women of age group 30 to 65 can take a Pap test alone after every 3 years. HPV test alone after every 5 years, or a co-test, which means both Pap test and HPV test after every 5 years. Moving on to the diagnosis of cervical cancer. Based on age, results of screening test, physical examination, and medical history, Further testing is carried out. Abnormal pap test result is followed by colposcopy. A colposcope is a magnifying device used to examine a cervix clearly. If areas of abnormal cells are seen, then biopsy is carried out. Biopsy means removal of small piece of tissue for microscopic examination. Biopsy gives definite diagnosis of precancer or cancer. There are various types of cervical biopsies. Colposcopic biopsy. During colposcopy, a small section of tissue is cut using forceps and observed microscopically. Endocervical curettage. A curette is an instrument with hook or scoop-like tip which is used to scrape the inner side of the endocervical canal. Cone biopsy. A cone-shaped piece of tissue is removed from cervix under general anesthesia. Cone biopsy can also be used as a treatment for precancer and very early stage of cancer. Loop electrosurgical procedure. A heated wire loop using electric current is used for removing a section of abnormal area of cervix. It is used as both diagnosing test and treatment. Stages of cervical cancer. Stage 1. Cervical carcinoma is confined to the cervix. In stage 2, the carcinoma invades beyond the cervix but not to the pelvic wall or the lower one-third of the vagina. In stage 3, the carcinoma extends to the pelvic wall and the lower one-third of the vagina. Stage 4. Carcinoma extends to the bladder, rectum, and metastasis occurs. How is the staging of cervical cancer done? CT scan, PET scan, and MRI are used to measure the tumor size to see if metastasis is occurring or not, to see other regions where it has spread. Based on the results of the scans, physical examination, and biopsy, staging is done. Treatment is planned according to the stage and type of cancer, patient's age, desire to have a baby, etc. Surgery methods. Cryosurgery. In cryosurgery, the cancer cells are destroyed by freezing them with a low temperature device. Laser surgery. Using the laser to destroy the cancer cells. Cone biopsy and LEEP, that is loop electrosurgical procedure as mentioned previously. Laparoscopic surgery. In laparoscopic surgery, a small incision is made and a camera is inserted for observing during surgery. Open surgery. Large cut is made and the tumor is removed surgically. Trachelectomy. The whole cervix is removed for complete cervical cancer removal. Hysterectomy. If the cancer has spread to the uterus, then the whole uterus along with the cervix is removed. Chemotherapy. Medications are given to shrink the tumor. Radiation. High energy X-rays are used to destroy the cancer cells. A combination of chemotherapy and radiation. Cervical cancer can be prevented by having a healthy and proper lifestyle. Reduce the risk factors by quitting smoking. Children of age group 11 and 12 are recommended HPV vaccine. There are 2 doses of HPV vaccine. The second dose is given 6 to 12 months after the first dose. Routine pap test and HPV test are essential for the early detection and treatment of the precancer and the cancer. Even though routine screening is very important, many women avoid getting screened. This is probably because of the stigma surrounding it, shyness, less knowledge about cervical cancer, importance of screening, or having low financial background. Therefore, awareness about the importance of screening, education on cervical cancer, and breaking the stigma is important because prevention is always better than cure.